Bismillahirrahmanirrahim. Assalamu alaikum ji. Mera naam hai Salem Rehman. I'm the Vice-Chancellor for Noor International University, and I'd like to welcome you in today's session, जो हमारा Facebook Live session होता है. हमारे guest आज जो हमें join कर रहे हैं is Mr. Irfan Khan. Irfan Saab is the CEO of Evercare Hospital here in Lahore. Irfan Saab, assalamu alaikum and welcome.
Ji, assalamu alaikum. How are you?
Very well, thank you, and thank you for joining, sir. So in typical fashion, जो हमारा session का flow होता है, I'll hand it over to the admin team to run a quick introduction video of Noor International University, and then we'll be right back to do a formal introduction and launch our show. Over to the admin team. Okay जी, and welcome back. मैं इरफान साहब का तारुफ करवाता हूँ जी formally. With over 25 years of experience in operations management, business development, revenue generation, and P&L management, Mr. Khan has been involved in implementing his visionary leadership to establish and nurture business units and projects in various national as well as international organizations. Having served as the CEO of multiple renowned hospitals, he has developed outstanding skills in corporate business planning, culture shaping, leadership, and health systems and optimization. Mr. Irfan is currently the CEO of Evercare Hospital here in Lahore, Pakistan, and has been recently selected as one of the top 100 performing CEOs of Pakistan. Irfan specializes in engineering and management degrees from renowned universities globally. He is also considered an expert in turnarounds and organizational change management for hospitals. Irfan Saab, with that introduction, welcome to the show, and I'll hand it over to you, sir, for further, I think जो typical हमारा opening सवाल होता है to lend a little bit of let's say flesh on the bones. आप help us understand कि इरफान साहब कौन है जो हमारे सामने आज बैठे हैं. How has his journey been personally and professionally to bring you where you are today? And then we'll launch into our subject matter for today, which is leadership in healthcare, quality, focus on quality and ethics. So over to you, sir.
Salem Saab, thank you so much, and thank you to Noor International for this session. It's great to be here, and I'm excited to have this chat with you. My journey is an interesting one. So I grew up and schooled in Kenya. So I was born and brought up in Kenya, in East Africa. My roots are from Pakistan. Lekin जो है ना, home for me is Nairobi, Kenya, and so Pakistan has always had a special place in my heart. And one of the reasons for that is that जब मैं university में पढ़ रहा था, when I was in the UK many years ago, I was doing my degrees at Imperial College in London, and बहुत सारे पाकिस्तानी students उस वक्त होते थे. We'd be together, we'd eat food together, we'd have a cup of tea together. So a lot of them used to tell me कि जो है ना, हम पाकिस्तान से निकले हैं तो हमने वापस नहीं जाना. It's very difficult, it's a tough environment, and we'd like to stay outside, and we'd like to work in the West. And I used to tell them that, look, you पढ़े लिखे वापस नहीं जाएंगे तो फिर मुल्क कैसे सही होगा ना. आप लोग वापस जाएं, अपने मुल्क को सही करें, participate. And so I think that really was my philosophy कि भाई ठीक है, I will actually do that. And so I'm really happy to say that I have actually done that over my life. I came back, to Pakistan several times. I went back to Kenya, then came back again, and I've had quite a long stint in Pakistan. And I think that has really, been an eye opener for me. It has been wonderful to see how we can see things progress, even in a difficult, environment. Things may not be as smooth as we would like them to be. If we all put in the effort, then things will happen. So I think my philosophy is that, go where you are needed, go where you can give an input. And I think Pakistan is that kind of country that needs, good people to come in. There's lots of opportunities. There's good opportunities. Unfortunately, Pakistan gets a lot of bad press. And I think we are responsible, to turn that around, to project a good image of Pakistan. And that's something that I have done throughout my life. And even as I am the CEO of Evercare, Evercare is a big foundation. It's a big platform. It has 30 hospitals in 5 countries, over sort of 2 continents. And one of my missions is to show that Pakistan, within the Evercare group even, is a very viable, good opportunity country, with some, good people who can do some good work. So I think that's sort of been the journey. I did my engineering, all my degrees from the UK. So I'm actually a chemical engineer by profession. And then I thought to myself, I want to work in a hospital. And how do you do that without being a doctor or a nurse? So I did this degree that actually, it was called Engineering in Physical Science and Medicine. So ye degree very interesting thi. What it did is it brought engineers and taught them medicine, and it brought in doctors and taught them engineering. So it really brought the engineering and the medicine, fields together. So very unique cheez thi, and I opted for that, and it was wonderful. And so that then started the journey in a hospital, and I soon realized that I'm, sort of a good manager. And I always define a good manager as someone who can, who knows how to manage people well. एक machine जो है वो तो जब भी आप वो button दबाएंगे तो it will always do the same thing. But human beings are all different backgrounds, different experience, different education levels. And a good manager will not use the same formula to manage every human being. You need to get to know that human being. You need to build a relationship. You need to understand, and then you can be a good manager. So I soon realized that I was good at that. I think that emotional intelligence was there. And then I went back to Imperial College to do my MBA, and I did my MBA in customer focused strategy and entrepreneurship. And as they say, the rest is history. So then I went into hospital management, and I've spent most of my hospital management time at the Aga Khan University Hospital in Karachi, also in Kenya, in Nairobi and Mombasa. Almost 15 years of my working time has been with the Aga Khan system, which undoubtedly is, I think, one of the best systems that we have in Pakistan.
Definitely, and thank you for sharing that journey with us. So Irfan sahab, आपने multiple बातें की हैं जिस पे I'd like to dilate upon further. पहली वाली ये कि always good to meet a fellow engineer. I'm also an engineer, so आपका stature suddenly मेरी आंखों में तो definitely has gone a few levels above, not just one level above. But other than that, of course, जो मुझे interest इसमें है, because we're talking about healthcare today, और आपका healthcare का experience from multiple standpoints, multiple perspectives. आपने NHS का system भी देखा है UK में जब आपने time गुजारा. I know that Kenya is probably within Africa one of the most developed countries, so उसका healthcare system भी आपने देखा. फिर आप पाकिस्तान आए और आपने पाकिस्तान के standards देखे, और Aga Khan, like you said, it's a beacon of light for a lot of things, and of course healthcare being उसमें उस space में वो dominant है as one of the few places where perhaps we can safely say कि लोग doctor के लिए नहीं जाते, they go for the institution because they understand कि वो systems इस तरह के हैं, वो systems support करेंगे आपके health को. Simultaneously, however, what I would also be interested in is your thoughts, because हम एक macroeconomic level पे बात करेंगे. जो health card वाली scheme शुरू हुई, यहाँ पे कोई universal healthcare इससे पहले नहीं था. NHS में भी आपने देखा, आप एक बहुत different Evercare is serving a very different market. इन सारी चीजों को अगर जहन में रखते हुए, अगेन वेरी डिफिकल्ट क्वेश्चन, बट मे बी इन 3 or 4 minutes अगर आप अपना एक्सपीरियंस शेयर कर सकें कि बेस्ड ऑन व्हाट यू सीन इन द पास्ट, आपका क्या ख्याल है हमारे कोर चैलेंजेस हेल्थ केयर के पाकिस्तान में क्या हैं?
सो देखिए, आई थिंक द कोर चैलेंज जो है बेसिकली मैं तो उसकी जो है ना बॉटम लाइन ये कहूंगा, जो हमारे आज डिस्कशन का टॉपिक है, इज क्वालिटी एंड एथिक्स. This I think is the foundational problem that we have in many emerging markets, not just Pakistan but emerging markets. Mein ethics or quality in healthcare, I think these are should be the pillars of any healthcare system, and even any educational system. So I would say education and healthcare, these two fields should have quality and ethics as their top priority. Unfortunately, in emerging markets, including Pakistan, ये चीज नहीं होती, quality और ethics पे ज़्यादा focus नहीं होता, for several reasons. One reason is also that people just don't know what is good quality, what is ethics. Culturally, हमारी चीजें कुछ इस किस्म की चलती हैं, so people grow up without that knowledge, and then it becomes second nature to them to be doing the wrong thing, and they don't know they're doing the wrong thing. And so I think the link between healthcare and academics is very important. We need good universities like yours to help people understand, to educate people, and to link with hospitals like ours to tell people that every hospital is not the same. There's a different mechanism, for a quality and an ethical standard of system. So I think, to summarize, basically, मतलब ये issue जो है quality और ethics का, ये सबसे बड़ा मसला है. कीनिया में भी मैं ये देखूं तो ये issue है. NHS is obviously a different ball game, and why do we look up to the West? Because they are structures and systems, and so I think system development जो है ये सबसे एक मुश्किल चीज है. That how do you develop systems? Things should not run, hospitals, institutions should not run on a person. They should run on systems. And if you can build those systems, then those systems go forward well. And that's the most difficult thing to do, building systems. So agar systems बनाएंगे, and I think अगर हम बात करें governments की, तो I think ये सबसे बड़ा मसला है कि system नहीं बनता, system नहीं बनाते. And this is where we need to now, I think, focus and build systems. What I'm trying to do at Evercare is build a system here that could be a model for others. So people can look at this system, copy this system, learn from this system, and develop. So अक्सर ये होता है कि हमारे markets में we don't like people knowing what we are doing. हम छुप के करते हैं काम के, वो copy ना कर जाएं. मेरी philosophy बिल्कुल फर्क है कि I would love it if people copied, because that means that we are doing something right and we'll change the market that way. कि अगर आप इस hospital में हम कुछ अच्छा काम कर रहे हैं और दूसरा हॉस्पिटल हमसे सीख के वो अपने हॉस्पिटल में काम करना शुरू कर दें, तो I would be the happiest person. कि भाई we are then the trend setters, we are the market leaders, because people will learn from us. And why not? Because that helps the whole healthcare market get better and move in the right direction. So I think collaborations, partnerships, ये सब चीजें बहुत important है आजकल की दुनिया में. Silos में काम नहीं कर सकते. We have to work together, we have to build together, and we have to face the challenges together.
बिल्कुल, वेरी राइटली सर, आपने जो ये बात की कि जी इंडिविजुअल डिपेंडेंस नहीं हो सकती, बिकॉज यू प्रोवाइडिंग अ क्रिटिकल सर्विस. सो हैविंग अ सिस्टम एज अपोज टू अ पर्सन ड्रिवन अप्रोच इज डेफिनेटली द की. और जैसा आपने कहा कि वाकई आई थिंक हैट्स ऑफ टू यू कि जी देयर इज नो एलिमेंट ऑफ के कंपटीशन क्या करेगी या कोई कॉपी कर लेगा. अगर वाकई आप बाय नेचर एंड एज अ कंसर्न्ड एफर्ट अगर आप एक बीकन ऑफ लीडरशिप बन सकते हैं, somebody who blazes the trail. And again, Aga Khan has shown कि जी ये वाकई possible है. It creates a system within a state within a state in good terms, and I'm sure कि inshallah Evercare, because it operates I think on a multi country basis, आपकी best practices हैं जो कि leverage की जा सकती हैं. ये बताइए थोड़ा सा अगेन गोइंग टू द पास्ट, जो आपके एक्सपीरियंसेस हैं अगेन यूके के, जहाँ पे एक सोशियो इकोनॉमिक कल्चर है, एक स्टैंडर्ड है ऑफ of standardization of systems. What have been the major challenges and how have you been able to overcome them? Pakistan जैसे एक मुल्क में जहाँ पे unfortunately हम बहुत जल्दी subvert हो जाते हैं because हमारे ingrained नहीं है to follow a system. We all want to blaze our own trails in many different directions, which can be a little counterproductive. Can you shed some light on leadership challenges that you face? Because I think aapki ye challenges will be relevant, very relevant for our students who are well about to enter the higher education arena or are currently in the system and will be entering their their professional phase of life. I think it will be helpful for them to understand your perspective.
Sure. I think that's a great question. I think especially for the students, what I would say is that everything that you do and everything that we do in the hospital, what we should do is do it around a framework. Western world ke andar, the systems are built because there's frameworks, there's policies, there's procedures, there's standard operating procedures that people have developed over the years. Best practice has been developed over the years. And then it is, there's a framework developed. So for example, Joint Commission International, a framework hai, accreditation body hai, which is the gold standard for hospitals in the world. It gives you that framework. It puts you in the right direction. So even if a hospital is not going to go for the certification for whatever reasons, but आप उस framework को देखते हुए अपने structures, systems को उसके मुताबिक बना सकते हैं. Because they have searched the whole world, they have had experience and they have created this framework. The Canadians have their own framework. The NHS has its own framework. In Punjab, we have the Punjab Health Commission. They have also developed a framework, and a lot of that framework is based on these other frameworks. So framework के अंदर अगर हम काम करें, तो फिर it makes life easier. You can explain things to people. You can actually have proper, guidance and benchmark with others, etc. So I think, tackle the issue of discrepancies, different systems, different procedures, different things happening, different treatment plans, different ways of looking at things. Approach kya hai? When a patient comes into your emergency, one doctor will approach one way, the other doctor will approach another way. What's the best way? What's the benchmark? What's the world standard? You put those pathways in place. Those pathways help you make decisions and standardize the process. So I think accreditation is a very big thing. Again, in emerging markets, मसले मसाइल क्या होते हैं? वो ये होते हैं कि वो जो framework है, आप उसको आपके पास है तो सही वो, लेकिन आप उसको honestly follow करते हैं कि नहीं करते? आप उसको as a paperwork करेंगे कि बस just tick all the dots, join all the dots and tick all the boxes and say, okay, we are done. But on the ground, you don't see it. So मेरी जो philosophy है about quality and accreditation is that when somebody walks into my hospital, they don't need to see a certificate on the wall to say we are accredited. They should feel it by the service. They should feel it by walking around saying, okay, these guys must have some accreditation. There is systems in this hospital. There is process in this hospital. There's a standardization in this hospital. There's a common courtesy in this hospital. It's not a free for all, And I think in emerging markets, again, in Pakistan, you see that in a lot of hospitals. Sometimes you'll have a good receptionist and he or she will treat you well and treat you nicely and smile at you. And the next time you come, you'll have another person who won't even look up from their desk to greet you. So वो standardization आप कैसे लेके आते हैं? वो framework को आप follow करेंगे, लेकिन honestly follow करेंगे तो ये बहुत important बात है. फिर वही ethics की बात आ जाती है कि आप ethical होंगे तो फिर आप उसको सही तरीके से follow करेंगे. The last thing that I would tell students is be very real. Don't pretend that you know everything. Don't pretend that everything is great. Be open to asking questions, be open to learning, and understand that yes, you're not expected to know everything. You're not expected to be the best person in the world in your field. Even me as the CEO, I learn from my team. I ask questions. I say, I don't know what this is. Can you guys explain to me? And that starts a good dialogue, and you open up and you learn. So I think being open, having a culture, is so important. The organizational culture, इससे बहुत फर्क पड़ता है. अगर organizational culture is one of respect, is one of openness, good communication. That then helps the systems come and develop. So अगर systems को develop करना है तो कुछ foundational चीजें हैं जो करनी चाहिए, जो हमारे पाकिस्तान के बनने में भी थे. जैसे कायदे आज़म ने कहा था कि discipline is a very important component. You must have discipline, you must be honest, you must work hard, you must have the right intention. नियत आपकी अच्छी होनी चाहिए. तो फिर ये सब चीजें जो है ना line up करती हैं सिस्टम बनाने.
Great points, Irfan साहब. जो especially आपने कहा, आपने JCI का नाम लिया. Yes, I think it's a highly recognized. You don't have to reinvent the wheel. Luckily, in this day and age, आपके पास you have the benefit of hindsight. People having gone through the evolution process, gone through the steps of perfecting वही best practices. वो एक वजह से they're called best practices. So I think developing frameworks and आपने बिल्कुल सही आई थिंक हमारे स्टूडेंट्स को भी गाइड किया कि अगर आप फ्रेमवर्क्स के तहत चलें तो हर एक चीज के लिए देयर इज फ्रेमवर्क्स दैट यू कैन दे बिकम हुक्स इन योर माइंड कि आप उनको रिकॉग्नाइज करके एक स्ट्रक्चर के साथ चल सकते हैं टू हेल्प डिफाइन वेयर यू वांट टू गो. एंड देन कल्चर की जो आपने बात की, आई थिंक अपना एक वर्क एथिक डेवलप करना, दैट्स योर कल्चर. फिर जिस ऑर्गेनाइजेशन में आप जाते हैं, I'd also like to add on to what you said, Kiji. You'll be surprised that no matter how large the organization, आप culture के अंदर एक meaningful you can move the needle. Let's put it that way. हर किसी इंसान में वो एक capacity होती है to influence. आपके केस में माशाल्लाह, I think again sitting as you grow up into the organization and now mashallah at CEO position, आपके पास the ability to set the cultural norms and then retain the cultural norms, I think are very important parts and parcel of your leadership. And I think जो आपने tone set किया है उसको बरकरार रखना एक बहुत important part है. ये बताइए इरफान साहब, if we can perhaps again for the benefit of our students draw on आपका experience at Evercare here in Lahore now as you built up this new hospital. अभी तक किस तरह की आपने किस तरह के real world examples किए, if you can help us understand about making sure that you are actually following up on your vision of providing quality service with ethics की जो बात है. Can you walk us through a few tangible kind of steps that you've taken and outcomes that you managed to achieve?
Sure, absolutely. I think several things that I can give examples, but overall what I would say is that ethics and quality starts with getting the right talent, getting the right team together. So again comes back to the culture. जब आप कल्चर डेवलप करेंगे, ऑर्गेनाइजेशन को सेटअप करते हैं, तो आपकी टीम makes a big difference. You have to have the right people, they have to have the right experience, the right qualification, they have to have the drive, the energy. So I think बुनियाद जो है वो टैलेंट पे आता है. और अर्लियर जब हम बात कर रहे थे और अफ्रीका की हम बात कर रहे थे, आई थिंक पाकिस्तान में और अफ्रीका में फर्क ये है कि टैलेंट हमारे पास बहुत है. I think Pakistanis are well talented, amazing talent, and unfortunately what happens is when they go outside of Pakistan is when that talent is actually much more visible. And uski reason ये है कि यहाँ talent जो है ना उसको channel करने का तरीका systems नहीं है. Mentorship यहाँ बहुत कम है. I think students need mentorship, and I would, if you don't have it in your university, I would highly recommend that students should have mentors. At that stage, they should have mentors who they can ask questions, they can go through. Your alumni, when they have graduated and they go away, they should continue having mentors. I think having mentors throughout life makes all the difference. And in Pakistan, we need to develop the mentorship sort of program because people don't know how to be mentors. And a mentor should be selfless, not selfish. I will not help you because it's good for me. I will help you because I want you to succeed. That is the key. ठीक है ना?
Sorry, इरफान साहब.
डेवलप होगा कि हम अपने आप को चीजों को पहले तो टीम डेवलप करें, टीम को स्टेबलाइज करें, टीम अच्छी आए, फिर फ्रेमवर्क्स को लेके आए. So I'll give you a couple of examples जो हम बात कर रहे थे कि how do you become trailblazers, how do you become trendsetters. So in our hospital, we, before COVID, people did not do hand hygiene, that frequently, but COVID made us all do hand hygiene. But before COVID, when I was running a hospital in Multan, what we did is we taught our staff, our nursing staff, that when you do your hand hygiene before touching the patient, tell them what you're doing, explain to them what you're doing, tell them the benefits of this, teach them how to do it themselves, and teach them why, if they did it for themselves, even when they're well and they're at home, would it make a difference. So ये बड़ा अच्छा एक initiative था, but इसका जो एक side effect या knock-on effect आया था, which was unprecedented, was कि those same patients, when they went to another hospital and the nurse there did not do the hand hygiene and touch the patient, वो उसको रोकते थे कि भाई नहीं, उस hospital में तो वो ये 7 steps follow करते हैं, आप क्यों नहीं कर रहे? And the patient would actually teach the nurse. So, that to me encompasses good practice, ethics, quality, education, linking all these things together. So, इस किस्म की चीजें बहुत होती हैं. यहाँ हमारे hospitals में बहुत सारा जो है ना तनकीद hospitals पे ये होती है कि they're all in it to make money. Patient बस land हो जाए आपके hospital में तो वो 10 tests हो जाएंगे, lab हो जाएंगे, radiology हो जाएगा, CT scan, ये वो सब. And patients are very concerned and worried about it. Now, आजकल की दुनिया, medicine is become so complicated that doctors do need to have some labs and some radiology to make diagnosis, proper diagnosis, etc. I think वो ज़माना अभी काफी दूर चला गया है जहां डॉक्टर जो है ना वो इधर नस पे हाथ रख के कहता था कि आपको ये मसले मसाइल हैं. So there's a basic need for certain basic tests. But what we do at Evercare is to make sure that there's no unnecessary tests that are done for patients. And we explain this to them. It is a tough job because they don't, they see it, they come in with the notion that we are going to be swindled. We are going to be told to, get all these tests done. So what we see is that sometimes patients say, nahi, hum nahi karate, and they leave. But then an hour or two later, they call back saying, I'm still not feeling well. I'd like to come back, And then when they come back, they are treated well. And then they understand, yeah, you were telling us the right thing. And we appreciate that you were telling us the right thing. So I think there's examples like that we can see within the hospital where, it all starts from the team, the teamwork, getting the right talent. If you have the right people doing the right job, and leadership is so important, कि अगर मैं quality और ethics पे focus करूँगा, तो फिर it will trickle down into the institution. And if I do not focus on it or I don't have an emphasis on it, then people will not take it seriously. So I get into it myself. I lead the quality initiatives myself. I have a team to do it, but I participate. I sit in the meetings. I sit in the forums. I participate as much as possible. So the visual, the leadership is visible, and that helps people understand. So I think ये कुछ चीजें हैं जो हो सकते हैं. Lots of examples of, for example, patients, attendants. मैं हमेशा ये कहता हूँ कि patient जब admit होता है hospital के अंदर, तो patient तो probably is mostly drugged, they're sleeping, they are not well. लेकिन जो attendant है, जो बैठा हुआ है और वो देख रहा है कि क्या हो रहा है मेरे patient के साथ, वो बंदा emotional है. It's their mother, their father, their son, their daughter, their brother, their sister. They're sitting and they're perfectly well. They've got nothing better to do. So they're observing very carefully what this hospital is doing. When the nurse comes in, when the doctor comes in, what are they doing to my loved one? So हम attendants के साथ बहुत ज़्यादा, we give them attention, we talk to them because they're also going through some emotional, issues. We teach them how to care for the patient when you take them home. But we also have attendants who get upset and they're not happy with what happens. So when they come to me, sometimes they say, we want to see the CEO, we want to complain. I have told my team, outside my office, whenever a patient or attendant comes, if I'm in an internal meeting, we will stop the meeting, they take priority. If it's an external meeting due to the respect of someone coming from outside the hospital, we'll ask them to wait for a while. But, I see them, and when they come and sit in my office, the first thing I ask them is, we will continue to talk and I'll hear all your grievances, but let's make sure your patient is okay. Let's make sure your patient is safe. Let's make sure your patient is well. So what can we do to help your patient? Let's focus on that first. Then we'll talk about And as soon as I say that, their reaction is immediately, you know, the blood pressure comes down because that's what they're concerned about, but they don't know how to approach it. So as soon as we approach it that way and we focus on the patient, you know, that makes all the difference. And that to me is the crux of running a hospital. Every decision you make, you put the patient at the center of it. So it sounds simple and it sounds very doable. Again, you'll be amazed to see that how many management teams, make decisions without even thinking of the patient. You know, बैठ के वो decision कर लेते हैं board rooms में, meeting rooms में, और patient का किसी ने नामो निशान नहीं है team में. You see, so that is something that I think we focus on a lot here. The other thing that I think is very important to run a hospital is to respect your doctors. You know, doctors के ऊपर तनकीद बहुत होती है. Doctors are the backbone and important piece of your hospital. And without doctors, you will not, be able to operate. You need the doctors, right? So you have to respect them. Now, a doctor is, trained to look after a patient, a certain disease, and you should, management's role, my role is to provide that doctor a level playing field, a platform with all the support, with all the resources to do his or her job. And if you can do that, they then do a brilliant job. But as soon as you start policing doctors, it causes all sorts of disruptions and egos and problems. And then the last thing I would say is nursing. Nursing is again a backbone of the hospital. Without nursing, you cannot run the hospital well. And I always say that patient ke sabse mushkil time pe, it's the nurse who is at the bedside. The doctor will come, the consultant will come, do their round, give their medication, give their treatment plan and leave. But it's the nurse when the patient is in pain, when the patient needs to go to the washroom, patient needs to eat food, it's the nurse who facilitates. So nursing is so important. And I feel, unfortunately, nursing is very weak in Pakistan and again in emerging markets. And one of the reasons is it's not taken seriously, it's not given credibility. So I think respect for nurses, is really important. And nursing is considered as a only female profession, but that is, changing. Lots of males are now coming in nursing. And so I think we need to really, improve the nursing landscape in Pakistan, especially in Punjab.
Bilkul. I think Irfan Sahab, you've hit quite a few nails on their head, and nursing ki, I'm so happy that you brought this up, because I would have brought it up as a very key area which has been neglected. And bilkul aapne sahi kaha ke Punjab mein male nursing used to be just not an option. It used to be discouraged. Sindh actually was, as we know, on the forefront of allowing male nursing. They've been there for ages. Hamari hospital mein bhi, Fatma Memorial mein, jo sari male nurses thing, they were mostly Sindh board trained. So that was a sad reality कि आपने इतने लोगों को इस noble profession से बाहर रखा. And completely agreed कि जी nursing जो front line, front facing आपके troops हैं, they're actually the nursing care staff, because they are there to hand over, take over from the liaison doctor. तो चंद मिनट के लिए आना है, देखना है, check up करना है, she will leave, and the nurses will take over for administration, for execution of the orders there. We're proud to say that at Noor International we were awarded as part of the charter nursing college. We have a current nursing college which is affiliated with our medical and dental college on the Fatma Memorial College of Medicine Dentistry. Lekin we are now also inshallah starting up a new campus here at on Raiwan Road in our main facility, and also starting MS nursing inshallah as we emerge, because baki jo hamara Pakistan mein health human resource pyramid hai, it's inverted. We have more doctors to a nurse, because har koi doctor banna chahta hai ki ji usme ek pride hai, prestige hai, fine hai, but everybody cannot be a doctors, and so then the second line of allied health technicians is something that we really, us pe hum bahut focus karte hain, again both from the Fatma Memorial side and the Noor International side, applied health, applied sciences ke upar, allied health sciences ke upar, the technicians who operate either equipment or deal with patients. अटेंडेंस वाली जो आपने बात की, आई थिंक दैट्स रियली प्रीचिंग टू द क्वायर, बिकॉज एक जो बेड साइड मैनर है डॉक्टर की, नर्सिंग की, वो एक चीज है, लेकिन वाकई आपकी बात सही कि दैट अटेंडेंट ही और शी हैज टू टेक इन लॉट ऑफ केसेस डिसीजंस एंड देयर पुट ऑन द स्पॉट एंड उनके ऊपर बम्बार्ड कर दिए जाते हैं, बस ये है, आप बताएं क्या करना है, आपके पास ऑप्शन ए बी या सी है, या ऑप्शन ए ही है, वरना जी, they do doom gloom, and that's a sad reality. Counseling एक जो नहीं करवाई जाती है, I'm happy and I hope के जी, like you said के जी, not just in letter but also in spirit, इसको फॉलो कर लिया जाए, because again that's half the battle one of alleviating, वो जो आप कहते हैं ना, वो diffusing the situation. कोई आता है wanting to do lots of things with the doctor, at the end of the day they are just doing their job, maybe they can be better in explaining how to do it. So fantastic feedback, mashallah. And mentoring का आपने बात की, वाकई I think one of the key things जो यहाँ पे lack करती है in Pakistan is mentorship, and we at NIU at least हम encourage करते हैं कि जो हमारे students हैं उनको apprenticeships की तरफ focus करवाया जाए, हाउस जॉब्स, प्रैक्टिकल प्रैक्टिकम्स की तरफ फोकस किया जाए, बिकॉज अभी भी हमारी रिलेटिवली पेरिफेरल फील्ड सराउंडिंग हेल्थ में बहुत ज्यादा फोकस है, एंड वी रियली नीड कि वो उन पे हैंड्स ऑन एक्सपीरियंस हो बिफोर दे हिट द प्रोफेशनल वर्ल्ड, इफ पॉसिबल बिफोर दे आर चूजिंग द करियर. हमारे यहाँ पे पाकिस्तान में अनलाइक इन द वेस्ट, आप एक दफा एक डिसिप्लिन में घुस जाएं तो you're in it, that's your that needs to be a calling. You up left right nahi ho sakte, whereas in the west, perhaps North America more so than even UK, the ability for you to change very much exists or encouraged kiya jata hai. Higher Education Commission now is offering opening up dual degree programs and so on and so forth. So inshallah I'm hoping that will be a positive outcome.
Wonderful.
ये बताइए इरफान साहब, थोड़ा सा on again a macro topic, we just have a few minutes left. आपके ओपिनियन में पाकिस्तान की लैंडस्केप देखते हुए, एवरकेयर को देखते हुए, आपका आगा खान का एक्सपीरियंस देखते हुए, इंटरनेशनल एक्सपीरियंस देखते हुए, anything that comes to mind के as a on a national level, what do you think can be some of the things to help alleviate our level of healthcare in Pakistan on an overall kind of macro basis? Any 3-4 points that come to mind कि जी quick fixes क्या हो सकते हैं?
So I would say quick fixes. One is कि हमारे पास पाकिस्तान में pockets of innovation, pockets of good practice बहुत सारे हैं. तो a quick fix to me would be is bring all those together. So वही collaboration, partnerships. Why don't we work together? I think there is much more to be done if we work together. So myself as the CEO of Evercare, maybe we cannot do everything, and we should recognize that, and we should say, okay, let's partner with this hospital. They do this well, we do this well. Let's work together for the betterment of the patient. So I think collaboration, partnerships, getting those pockets of excellence where they are, and you'll be surprised. There'll be little hospitals, in small towns, जो बड़ा अच्छा काम कर रहे हैं, जिनकी बड़ी अच्छी leadership है, जिनके बड़े अच्छे doctors हैं, and they're doing a great job. Maybe nobody knows them, maybe they don't have enough funding, maybe they don't have much say, but they're doing a great job. And so I think that's an important thing, and I would say that would be probably the most important quick fix that we could make. When it comes to governments, I think governments, obviously healthcare needs to be given priority. It's the development goals of the United Nations as well. I think ये बहुत important चीज है. So the budgeting to the healthcare, having the facilities available. The second thing I would say is that ease of business. How do we change the market in Pakistan? And this is one thing that I'm proud of, leading the Evercare group here, because Evercare is probably the only sort of multinational hospital group in Pakistan. And a lot of these groups want to come to Pakistan, but they don't come in because of the difficulty in doing business here for all sorts of reasons: corruption, systems not in place, electricity, pricing, etc., etc. Now, if Evercare can come in and we can make this a success and show that Pakistan is a viable country and there's good, opportunity here for having what I call a double impact of a social impact and a financial impact. So it does, those two are not mutually exclusive. You can actually do a social impact and have a good financial impact. So I think we have to understand that hospitals can be good business, but you do not get into the hospital business to do business, And so my philosophy is always, hospital के अंदर लोग कहते हैं कि एक patient experience अच्छा होना चाहिए. मैं ये कहता हूँ कि वो patient experience किसने देना है? आपके employees ने देना है. So first you need to go one step before that and give a good employee experience. That in itself will convert into a good patient experience. If your employees are happy, they'll treat your patients well. Clinical quality has to be at the centerpiece of what you do. Community engagement is so important. The communities you live in, how you engage, and it again talks to the partnerships and the collaboration. ये जो चार चीजें हैं, employee experience, patient experience, clinical quality, community engagement. The side effects of these four things is volumes and revenues. That's where you make your money. And a lot of people have this pyramid the opposite way. The employees are at the bottom, they're the last afterthought, and everyone's focusing कि पैसे कैसे बनेंगे. So I think that model needs to change in Pakistan. And I think that's where international groups and people like Evercare, the groups like Evercare can help that happen, help people understand that this is a viable market, it's a good market. And I think बाहर से investment आएगी, लोग आएंगे, ऐसे के hospital set up करेंगे, तो बात बनेगी. Aga Khan Hospital कराची में है, probably the best hospital in the country, but we need 10 Aga Khans all over the country. One in Karachi is not good enough. One hospital of Evercare in Lahore is not good enough. We need lots. So एक group तो ये नहीं कर सकता. We need to collaborate. We need to work together. There's a trend nowadays of industrialists building hospitals. They have smooth running, highly profitable businesses, factories, and hospital is a nice thing to do. And it's a good thought. It's a good thing to do. Lekin, what's the vision behind it? Why are you doing it? That's the whole point. And I think there's a lot of learning, within that landscape.
Very true. And thank you. I think you've touched upon again some very interesting things. आपने last thing, most recent thing that you said first, कि यहाँ पे despite what appears on the face of it, there is a lot of potential for philanthropy. We've experienced it ourselves. कोई fundraising करें, छपड़ फाड़ के आपको वाकई fundraising है. इंडस्ट्री वाले वाकई कुछ करना चाहते हैं. Maybe वही अपनी 1.5 इंच की मस्जिद के बजाय अगर वो channelize करें अपने ये capital towards let's say people like you who have the quality standards जो कि वो बरकरार रख सकते हैं and open it up to a wider base. I think that's the way to go. जो आपने एक employees वाली बात की, I think 100%, because at the end of the day देखिए आप एक सर्विस सेक्टर में ऑपरेट कर रहे हैं, एंड सर्विस सेक्टर में जो सर्विस करने वाले हैं अगर वो खुश नहीं होंगे तो वो किस तरह की सर्विस आगे पास ऑन कर सकेंगे. सो ऑल्सो टेकन टू हार्ट. लास्टली एंड मोस्ट इम्पोर्टेंटली जो आपने पहली बात की थी कि कोलैबोरेशन, पॉकेट्स ऑफ एक्सीलेंस, I think multiple times we've obviously had a number of people like yourselves, leadership positions, जो कि healthcare में operate करते हैं, और इसमें कोई शक नहीं है कि हमारी मेडिकल एजुकेशन, हमारे डॉक्टर्स माशाल्लाह आर कंसिडर्ड अमंग्स द बेस्ट इन द वर्ल्ड. हम कितने लोग यहाँ स्ट्रेट अवे अपने एमबीबीएस करके यूएस एमएलईज करते हैं, अमेरिका जाते हैं, कनाडा जाते हैं, यूके जाते हैं, ऑस्ट्रेलिया जाते हैं, एंड वेरी मच इंस्टेंटली आप plug in कर सकते हैं into their system. Why? Because they recognize that you have a high standard of teaching and you're probably good. So इसका मतलब है कि वो एक्सेलेंस एग्जिस्ट करती है, उसको चैनलाइज करके अगर एक आप कोलैबोरेटिव एफर्ट वाकई करें तो that would be a win-win and a win for the people, for the investors, and of course for the people who can benefit from the service. We are at time, Irfan साहब, लेकिन आखिरी सवाल, how can we let you go before we ask the final questions? तो 2 in 1 कर देते हैं, क्योंकि आप माशाल्लाह हेल्थ केयर इंडस्ट्री में लीडर हैं और हम हेल्थ केयर इंडस्ट्री में बहुत सारे लोग सर्विस करते हैं who happen to be our students. Any words of wisdom, parting thoughts for हमारे current students who may be pursuing in particular allied health, applied science type degrees, medical degrees, dental degrees, even nursing degrees? general students and your thoughts, either as a healthcare leader or overall, parting thoughts before we break off.
So my parting thoughts are very simple. For students, I always tell my mentees as well, and any students who come to me is, ek to, follow your passion. Follow what your heart tells you. Follow what you want to do. Don't necessarily follow the norms. Don't say, engineer बनने में जो है ना पैसे बहुत हैं, तो इसलिए I'm going to become an engineer. Do what you're passionate about, and then you'll be successful. Because you'll do it with your heart, and then you'll be successful. It could be anything. So that's the first thing. Follow your passion. Number two, the three principles that I always have in every aspect of life, whether it's studying, whether it's working, whether it's family, whether it's friends, whether it's children, whatever, is niyat अच्छी होनी चाहिए, ईमानदारी से काम करें और मेहनत करें. These three things I think are the navigation tool that everybody needs. And if you just follow those, it's very simple. You will always be successful. Second last point I would say is that, आजकल के ज़माने में, especially for students, it's a WhatsApp का ज़माना. So people want instant results. They want instant, success. Patience, I think, again, for students, it takes time. Yes, आज वो ज़माना चला गया है जहां आप 20 साल बाद जाके CEO बनते थे या कुछ. Yes, it's accelerated. You can do it faster, but still you need patience. You cannot, expect to graduate and then start, earning immediately, big amounts. So patience, move yourself through. And the last thing is have a fire in your belly. Get to do what you want to do. And get out there and make it happen. Don't sit back and take no for an answer. And I think this is really important in our society, in our culture, because there's a lot of naysayers. And I think we need to be a nation of people who get up and say, okay, enough is enough. We need to fix this. We need to move this. And I think the current political environment, without getting into a political discussion, warrants that. We need people to stand up and say, okay, this is right, this is wrong. We're going to stand up for what's right.
Wonderful. I think ये जो आखिरी चीज कही वो वाकई, I think, staying hungry, be hungry. That's half the battle won. क्योंकि माशाल्लाह हम in Pakistan 220 मिलियन की आवाम है, 22 करोड़ लोग हैं. आपने mediocre रहना है तो you will have ample opportunity. You can probably be mediocre. लेकिन given कि आपको एक opportunity, एक privilege मिली है to be probably amongst the top 0.25% in Pakistan, जिनके पास higher education की opportunity आई है, तो वाकई इसको leverage करें. Use it to your advantage. Stand out. और वाकई जो नियत, ईमानदारी और मेहनत जो है, सारे स्टूडेंट कहते होंगे यार आप लोग बैठ के looking back, but hindsight is 2020. There's no shortcut. And I will say कि जो instant gratification, जो WhatsApp वाला ज़माना है, वाकई dynamics बदल चुकी हैं, इसमें कोई शक नहीं है. And dynamics बदल चुकी हैं, perhaps in the favor of the students जो कि आज graduate कर रहे हैं, क्योंकि शायद हमारे ज़मानों से ज़्यादा opportunities available हैं, entrepreneurial opportunities available हैं, आप excel कर सकते हैं, but shortcuts नहीं है. आपने मेहनत करके वो वहाँ पे पहुंचना है. And again, अगर आप अपने passion और your ability to earn को आपस में उनका निकाह कर दें, तो nothing better, I think, to be happy in the career that you choose. डिग्री आप चेंज कर सकते हैं, करियर भी चेंज कर सकते हैं, फ्रेश स्टार्ट भी ले सकते हैं. आई थिंक थोड़ा सा अपने मेंटल बैरियर्स को लेट डाउन करना है. सो इरफान साहब, सॉरी आई हैव केप्ट यू 4 or 5 minutes ओवर टाइम, लेकिन हमारी ये कॉन्वर्सेशन इतनी दिलचस्प थी दैट इट वाज ग्रेट इंटरैक्टिंग विद यू. आई एम ग्लैड विद द वे दैट द कॉन्वर्सेशन फ्लोइंग. यू डिड लेट ड्रॉप इन बिटवीन के माय मेंटीज, इसका मतलब है आप मेंटरशिप करते हैं, मेंटरिंग करते हैं, तो हम एक मलिहा को, अपनी सुपरस्टार को भेजेंगे आपके पास one of these days to maybe we'll let you pick and choose, but having वाकई a good mentor available for even a few sessions in a let's say quarter or in a year would be very beneficial. In a one-to-many settings bhi ho sakta hai, so that we can waste a little of your time. But we'd love to welcome you on campus, inshallah, very soon. And for the benefit of our students, Irfan Saab ke saath, we're trying to figure out how we can work professionally, collaborate professionally. Jis tarah bhi hamari baat hui, we have the ability to provide the much needed, very relevant industry academia linkage, which Evercare could use, which we could definitely leverage in real world research, not research for the sake of research, but meaningful research, जिससे हम फिर publish कर सकें और फायदा उठा सकें as a country and as people. Irfan Saab, with that, I'd like to thank you for the opportunity and for spending the last 50 minutes with us. Inshallah, we will be in touch and really appreciate your time.
Absolutely. Thank you so much. I appreciate it. It was enjoyable, and I look forward to staying in touch with you.
Inshallah. Thank you. Assalamu alaikum.
Assalamu alaikum. Allah Hafiz.
Allah Hafiz.